the disease itself. We can consider it having different phases. So once you get exposed, you get infected, that can be considered to be the first phase. And most people would have the mild form of the disease, so they would go through for the next 10 to 14 days without any problems. Might have a little bit of mild fever, some coughing, some people might lose smell or taste, and then they're okay. For others who would have like moderate to severe disease, those signs and symptoms would then turn into having difficulty in breathing. Once you start having breathing difficulties, you have to come to the hospital. There is a measurement that is normally taken to check the oxygen saturation in your blood. And if that is relatively low, then you would need oxygen. So most people would require oxygen once they get hospitalized, and we provide that. But then as the virus starts to multiply in your body, it then provokes the body to react to it. And during that reaction time, for some people, your immune system can overreact. That is sometimes called a cytokine storm, because you're now reacting to the virus, and that overreaction can cause multiple systems in your body to start failing. And with that failure, a lot of those patients will go into shock, and would have a number of other problems. So multiple organs can fail at the same time. So what we do is we observe patients, and if we notice that they're heading in that direction, then we'll normally give certain medication to mediate or to reduce the effects of this cytokine storm that the patients would be experiencing, and try to get them out of this phase as quickly as possible. Most of those types of patients would be in our ICU, and we'll treat them there. We have a number of specialists who would work there that are really specialized in infectious disease, in intensive care, to make sure that the patients get the best care that we can offer in this country.